Welcome to Let's Talk About Cancer, your source for enlightening discussions in the field of oncology. I'm your host, and today we have the privilege of having Dr. Satish C, a distinguished surgical oncologist, with us to delve into the topic of radioactive iodine therapy. Welcome, Dr. Satish.
Thank you. It's a pleasure to be here to discuss radioactive iodine therapy and its implications.
Let's get started with our first question. Dr. Satish, can you explain how radioactive iodine therapy is utilized in the treatment of thyroid cancer? Can you also explain the science behind its effectiveness?
Certainly. So, radioactive iodine therapy is primarily used for thyroid cancer treatment because the thyroid gland is unique in its ability to absorb iodine. Now, once the surgery is done and the thyroid gland with the tumor is removed, there should be no tumor left in the body, or whatever tumor is left in the body must have thyroid in it, because of which when radioactive iodine is administered orally, all the cancerous thyroid cells which also take up iodine also absorb the radioactive iodine. This radiation selectively destroys only these cancer cells pertaining to thyroid, whereas sparing all the surrounding healthy tissues.
Thank you for that clarification. Our second question is, what are the potential side effects or considerations that patients should be aware of when undergoing radioactive iodine therapy?
While radioactive iodine therapy can have side effects, including some temporary neck pain or swelling, dry mouth or change in taste or smell, patients sometimes may also experience fatigue and GI symptoms. We usually don't see any of these side effects at all. Most patients are comfortable during and after the therapy and get back to their routine in no time. It is more important that they follow safety precautions after the therapy is done and keep their distance from pregnant women and children to minimize the radiation exposure to others after the therapy, which lasts for about a week or two. And then it is important that they consult with their healthcare team to manage any side effects or to manage how they should take care of their health and what medications they need to take after the therapy is over.
Valuable information. And now for our final question. How do medical professionals determine the appropriate dosage and timing for radioactive iodine therapy, and what factors influence these decisions?
Radioactive iodine therapy is usually done after the surgery for thyroid cancer is done. And this therapy is usually done after about 4 weeks when patient has some iodine starvation diet and their TSH is checked and it's more than 25. But a lot of factors depend, such as the type, stage of thyroid cancer, extent of disease and patient's overall health. Even the dosage depends upon the type of disease, the extent of disease left behind and many other factors. The actual dosage is unique to each patient to be most effective for each one of them. A lot of clinical assessment and diagnostic tests help us make this decision.
Thank you, Dr. Satish C, for providing insights into radioactive iodine therapy in the treatment of thyroid cancer and its potential considerations. We appreciate your expertise on Let's Talk About Cancer.
My pleasure. It's crucial to inform patients about their treatment options, to dispel their fear about the same, and to let them know what to expect during the thyroid cancer journey. Thank you.